Welcome to the South Dakota Early Hearing Detection and Intervention Training Toolkit for the Well Baby Nursery and NICU. This training toolkit consists of 5 different videos. Before watching this first video, make sure you have taken the pre-training quiz. After watching all 5 videos, remember to take the post-training quiz. This first training video will cover the importance of early detection and intervention of hearing loss. Hearing loss is the most common condition present at birth. The incident rate of hearing loss is higher than that of several other common congenital conditions, including Down syndrome, spina bifida, and PKU, for example. Around 2 to 3 of every 1,000 children in the United States are born deaf or hard of hearing, which means that close to 12,000 children are born deaf or hard of hearing each year. An additional 4,000 to 6,000 children between the ages of 0 and 3 pass their newborn hearing screening, but then go on to develop a late onset hearing loss. If the hearing loss remains untreated, it can affect several areas of the child's development, including his or her speech, language, cognitive, and social development. Beginning with speech development. If a child cannot hear certain speech sounds because of their hearing loss, they will not produce those sounds when speaking. The child's pitch and rate of speaking might also be affected. Moving on to language development, the child's vocabulary may develop more slowly than the vocabulary of his or her peers. With social development, the child might feel unhappy at school and isolated from their peers. And finally, cognitive development might also be affected. The child may experience more difficulty in the subjects of reading and mathematics. The gap in academic achievement between the child and his or her peers will only widen with age the longer the hearing loss remains untreated. The earlier the child is identified as deaf or hard of hearing, and the earlier they begin receiving intervention services, the less of an impact the hearing loss will have across these different domains of development. Several studies emphasize the importance of hearing loss across these domains. One researcher found that children identified before 6 months of age have better developmental outcomes than children identified later, regardless of the severity of the child's hearing loss. Another researcher found that children with hearing loss who began intervention by 11 months of age showed higher vocabulary and verbal reasoning skills at age 5 compared to children who began intervention later. Auditory input is necessary for the growth of neural connections in the brain. These neural connections are important for the development of spoken language, reading, and auditory learning. If the auditory nerve is not stimulated, the brain will reorganize itself to receive input from other sources, such as vision. This process is called cross-modal reorganization, and it reduces the brain's neural capacity for auditory input. If the auditory nerve is stimulated, whether that be because the child has normal hearing, or the child has been fit with a hearing aid or cochlear implant, the brain will be receptive to auditory input and have increased neural capacity for auditory input. In the case of a hearing aid or cochlear implant, the earlier the child is fit with the amplification device, the better. This is because the brain experiences its greatest plasticity during the first 3.5 years of the child's life. A study by Gilly, Sharma, and Dorman emphasizes the importance of early detection and intervention. The image on the far left shows the brain of a child with normal hearing. The image reveals bilateral activation of the auditory cortical areas, such as the superior temporal sulcus and inferior temporal gyrus. The image in the middle shows the brain of a child who is congenitally deaf and who received a cochlear implant before the age of 4. This image reveals activation of the auditory cortical areas that are contralateral to their cochlear implant. The third image on the far right shows the brain of a child who is also congenitally deaf, but who received a cochlear implant after age 7. This image reveals activation outside the auditory cortical areas, in the visual, insula, and parieto-temporal areas. The key factor in this study is the age at which the child began receiving those intervention services and was fit with amplification. The longer the child's hearing loss remains untreated, the greater the effects of the hearing loss on the child's development. The child's social, cognitive, and psychosocial development are at risk. The child might also experience isolation and withdrawal. The child may display learning difficulties, have to repeat classes, get lower test scores, even if they have minimal hearing loss. They might also display distracted or disruptive behaviors. This ends training video 1. Please advance to training video 2.